Self-harm. It's the intentional, deliberate, and conscious act of harming oneself. Most of the time when you think of self-harm, you think of cutting, which is very common, but it could also be burning, hitting or pinching themselves, overdose, alcohol abuse, deliberately starving themselves or binge eating, forcing themselves to stay awake all night. It's anything that can cause harm to themselves. And I circled some common sites for self-harm in red on the body. There's also non-suicidal and suicidal self-harm. So non-suicidal would be like hitting or punching or staying awake all night. And suicidal can be cutting and overdose. So the signs and symptoms of self-harm are staying completely covered even in hot weather, having unexplained injuries, unexplained weight loss or gain, low self-esteem, and self-loathing. So if you notice self-harm, you should be kind and understanding and talk to them about it in private because they need your love, support, and accountability. Why people self-harm is to feel in control or to not feel numb. They have overwhelming emotional distress that they can't express. So they have a hard time expressing their feelings, and they can make that emotional pain into physical pain. And some examples are from being bullied, family issues, or struggling with their gender, sexuality, identity, sexual trauma, death of a family or friend, work stress, repeated thoughts or voices encouraging self-harm.
Okay, so what can we do for patients that are self-harming as nurses? The first thing that we want to do is we want to listen to every patient and we want to assess them for risk for further self-harm or risk for suicide. We don't want it to get to another level, and we want to try to nip it in the bud and just listen to the patient of where they are at the moment. Another thing that we can do as nurses is encourage them and work with them to try to identify maybe like 2 or 3 positive things about themselves and things that are like not surface level. So not things like I like my hair, but more so like I like that I'm kind to everyone, or I like my personality, or whatever it might be. This might kind of help them recognize their importance and their worth, and that is important, especially if they have maybe like chronic low self-esteem. So other things that we can do as nurses is help them to recognize that self-harm is a choice and that it is a choice they're making. A lot of times, as we just talked about, people who self-harm maybe feel out of control in some area of their lives, and so they might commit self-harm just to feel in control. But really, there's lots of things that patients can do to feel in control of some aspect of their lives. Maybe helping to get them choices. So helping them choose books to read or something like that. Or maybe it is helping them to plan out their daily schedule. And if they can calendar and mark, then they can realize that they are in control of their lives. And so it's more important to focus on helping them gain control in some area so that they don't seek for control through self-harm. Another thing that we as nurses can do is to help patients figure out what their triggers or what their limits are. Maybe if like watching movies with sexual assault or some other kind of abuse aspect are a trigger to them, then they need to try to avoid that and be careful of what they put into their mind. And so just helping people to figure out where their limits are, that is important in preventing self-control in the future.
For signs and symptoms of suicide, a tool to benchmark the risk and identify these signs and symptoms of suicide. A good tool is the Suicide Assessment 5-Step Evaluation and Triage. This evaluates the risk for development of suicidal behavior and is used for substance or alcohol abuse, and it can help develop a treatment plan and consults with patients to reduce the risk for the suicidal behavior. Some nonverbal and verbal cues that can be identified for suicidal behavior is that patients and people are usually very open with their cues or overt statements, and you must teach family and community to identify certain statements. And there are 2 different types of statements. There's overt and covert statements. The overt statements are statements such as, I can't take it anymore, I wish I were dead, or life isn't worth living anymore. Some covert statements are, "It's okay now, soon everything will be fine," "I won't be a problem much longer," or "Nothing feels good to me anymore and probably never will." Some nonverbal clues could consist of giving away possessions, writing letters, organizing financial affairs, and it is important to remember that the risk of suicide is greatest during the first year after the first attempt. And having suicidal ideations is huge for identifying the risk of suicide in a person. Some common signs and symptoms are feelings of hopelessness, sleeping too little or too much, mood swings, acting more anxious, or showing more rage and reckless behavior, changing in eating habits, again showing suicidal ideation because it's different whenever they just say that they want to commit suicide rather than actually having a plan of action and having a very detailed plan, and whenever they become withdrawn from family and friends. Some causes of suicide, or the want to partake in suicide, could be a prior attempt, other mental health disorders, substance abuse, family history of suicide, family violence to abuse, previous traumas such as jail, being exposed to other suicidal behavior such as family member, friends, or social media. Social media has become a huge influence on suicide. And the CDC states that women are more likely than men to attempt suicide, but men are more likely to die from suicide. And demographics are a big factor that put people at a higher risk and is the highest leading cause of death for ages 10 to 14.
Okay, lastly, we're going to talk about what we can do as nurses to prevent suicide or to eliminate suicide risks. So first off, it's important that we take every claim as serious. So if a patient comes in and they says they want to kill themselves, even if they don't seem to be serious, it's important that we take it as serious and we ask follow-up questions. So one of the most important follow-up questions that we can ask them is, do you have a plan to kill yourself, or how would you kill yourself? If they do have a plan to kill themselves and they have access to whatever material they would use, then that is, I guess, a more significant risk because they have access and because they've actually thought about that. So it's important to assess kind of like the severity or like where they're at. But with that being said, if someone comes in and says they want to kill themselves but don't have a plan yet, it is still important to take it seriously and I guess investigate further. If someone's in the hospital and they are a suicide risk, then we have different means that we can do to kind of help prevent that risk at the hospital. So for instance, we want to put like a live sitter in the room, someone who can just be with them at all times, keep them company, and just be watching for them to make sure they don't try to hurt themselves. And some other suicide precautions that we'll see is taking away things like any kind of extra linens or tubing or anything that can be used as a strangulation, as well as anything that can be sharpened or used to hurt themselves. So we want to remove these from the patient's room, just to reduce the risk while they're at the hospital. And then outside of the hospital, it's really important that we get them some help, maybe through some counseling, medication. We want to continue to work with them and not just have them here where we try to take care of them and then just send them off to the world. So it is important that we get them some outside help afterwards.